Hello, I am Rebecca Harper, and this is my Stakeholder Education Plan. The purpose of this presentation is the implementation of my DNP project in my clinic system. For this, I need to identify the stakeholders, what their roles would be in my project, what their educational needs are, the theoretical foundation that I'm using for teaching them, and the intervention delivery plan. Marana Health Center is a federally qualified health center. It is also beginning to take part as an accountable care organization. With this, we need to use evidence-based practice. We are also a community health center. We serve the low-income and medically underserved people. We are also nonprofit. Marana Health Center has 12 locations in and around Tucson, Arizona. Marana, Maine, or the original clinic, is up on the northwest side of town. I am in a Wilmot Family Health Center clinic that is on the far southeast side of town. My stakeholder groups are the upper management, Dr. Serrano, the practice manager, Annette Taylor, the nurse case manager, Barbara Bartell, and other clinical staff, the medical assistants and scheduling clerks. Dr. Janitza Serrano is the medical director of Marana Health Center. Her role in my project is that she must approve my plan for it to go forward. I've discussed my plan with her already, and she is interested in it. I need to show her the evidence-based practice foundation for my intervention. I also need to show her documentation of approval from the school's IRB, as Marana does not have its own IRB. I will also give her examples of the tools that I plan to use. Annette Taylor is the practice manager at Wilmot Family Health Center. Her role is that she must be willing to allow me to perform this in her clinic. Her educational needs are a basic understanding of the project, the benefits and risks to her staff and to the clinic, and how much time it's going to take from her staff. Barbara Bartell is the nurse case manager at my clinic. She is the person at the heart of the implementation of my project, so she needs an understanding of the entire project. I will sit down with her and go over all of my data with her. She needs to know how and what to teach our patients, and she will also give them a pre- and post-evaluation questionnaire. The medical assistants will assist the case manager with teaching as needed, giving the patients handouts. They also check vital signs and weight. They need an overall view of the basic teaching plan. The scheduling clerks need to schedule patients' time with the case manager. So they need to have an overview of the plan to be able to answer patients' questions and know what the time needs are for the case manager to teach this project. The theoretical foundation that I am using for teaching the staff is the self-determination theory by Edward Deci. I believe that people do perform best when they're intrinsically motivated. So if my staff understand the reasoning behind these changes and how they will help our patients, I think that they will be more likely to want to help in this project. So for a change to take place, they need to understand the need for the action. They need to be able to make an informed choice without being pressured to do this. This is my intervention delivery plan. I will get approval of the plan by upper management, Dr. Janitza Serrano. I will discuss this plan with my clinical staff. I will sit down and teach the case manager all about my project and the methods that I want her to use. I will then refer patients to her for teaching. The teaching will take place, and then data collection will be performed, and we will also evaluate the data. This is the PowerPoint I will use for teaching them. Hello, my name is Rebecca Harper, and this is my evidence-based practice physical activity intervention for the sedentary obese adult. As all of you know, I'm working on my Doctorate of Nursing Practice, or DNP. For this, I need to answer an evidence-based question. My question is, in obese sedentary adults, how does focused patient-centered exercise intervention with enhanced activities of daily living improve compliance and overall well-being as indicated by answers on a questionnaire over a 6-week period? We all know that there are risks to the sedentary lifestyle. People can develop type 2 diabetes, high blood pressure, have a stroke, coronary artery disease, non-alcoholic fatty liver disease, gallbladder disease, osteoarthritis, cancers, depression, pregnancy complications, sleep apnea, and other breathing problems. I propose an evidence-based practice intervention to improve the physical activity in our patients. So we will want to educate them on this plan. We will provide them with an exercise plan, motivate them, provide encouragement, and try to meet the National Heart, Lung, and Blood Institute guidelines that recommend a minimum of 20 minutes of exercise at least 3 times a week. How are we going to implement this into primary care? We are going to sit with the patients and discuss their current activity levels. We will discuss what they see as their barriers to exercising. We will also find out what they used to do, what they used to like to do. Did they garden? Did they dance? And why they're not doing it anymore. Perhaps we can find ways to overcome that or just encourage them to start doing that again. We will also offer them a personalized exercise handout and provide them with the motivation and encouragement to keep doing this. What is your role in this project? The provider will identify the obese and sedentary adults and refer them to the nurse case manager. The scheduling clerks will schedule these patients for a case management appointment. The case management will give the patient a pre-questionnaire. They will educate them about increasing their activities of daily living and follow up with them over 6 weeks, and then we will give them another questionnaire afterwards. The activities of daily living that we are talking about increasing are simple things that people do every day. So if you are vacuuming, we would have you just vacuum longer and more thoroughly. Or if you are going to the grocery store, you park further away so that you're having to walk further from your car into the store and then back out again. If you're bringing in groceries, you bring them in one bag at a time so that you are taking more steps to do this. If you're unable to be mobile in these ways, then there are things you could do sitting down, such as folding laundry, unfolding it, and refolding it. The object is just to increase your activity in some way. We will follow these patients over 6 weeks, as I said. Outcomes. We will evaluate the intervention and refine it as needed. If we are finding improved outcomes in our patients that they are exercising more, we could then expand this to some of the other Marana clinics, and the other case managers could also teach this. We can use this intervention over time to do another study to evaluate decreases in body mass index, hemoglobin A1C, and blood pressures. These findings can assist us in meeting our goals for creating healthier patients and reduced healthcare costs, and thus we would be meeting the ACO guidelines. These are my references. Thank you very much for your time. Does anyone have any questions? Thank you.